gonna run grab some water. I'll be right back. All right.
So we'll get started in just a minute or two. We're gonna let folks continue to come in. So we'll get started soon. Okay, I'm gonna go ahead and get us started while people are still coming in. Thanks everybody for joining us. I'm Christy Giuliano, the Executive Director of the Big Cities Health Coalition. Gabby, can you go to the next slide? BCHC is a forum for leaders of America's largest metropolitan health departments to exchange strategies and jointly address issues to promote and protect the health and safety of the nearly 62 million people they serve. So again, thanks everybody for being here. We're excited to be having another one of these discussions today. So we'll go over some housekeeping. So the session is being recorded. All of the lines are muted except for the speakers. If you have any technical, any technical difficulties, you can use the raise your hand feature or chat Gabrielle Nichols with questions. You can also use the chat feature to ask questions of the panelists, which we'll get to a little later into the session. So with that, I'll introduce our speakers. So Gibbie Harris has been the director of Mecklenburg County Health Department since 2017. Mecklenburg County is home to Charlotte, North Carolina's largest city. Previously, she was the director, and I should have asked Gibbie how to say this, Buncombe County?
Close enough.
Cool, for 6 years. And in Wake County, serving as the health director there for 10 years. During her tenure in Buncombe, the county won the RWJF Culture of Health Prize. In addition, Gibbie was also the founding executive director of the hospice program and a nurse practitioner at a rural health clinic in Wilkes County. She graduated from UNC Chapel Hill School of Nursing with a bachelor's degree in nursing and a nurse practitioner's certificate, and from the UNC School of Public Health with a master's of science in public health. Thanks, Gibbie, for being here. And then Colleen Bridger is the assistant city manager for San Antonio and is also currently the interim director of San Antonio Metropolitan Health District. In these roles, she has oversight of the Health District, Parks and Recreation, the Office of Equity, and Department of Human Services, and is responsible for implementing policies and programs aimed at improving the health of the population in San Antonio and Bexar County. She was previously the health director for about 2.5 years before moving to the city manager's office. During her tenure at the health department, the city won both a City Health Silver and Gold medal, as well as the RWJF Culture of Health Prize. Prior to moving to San Antonio, Colleen was director of health departments in Stokes County, Gaston County, and Orange County, all in North Carolina. So you'll see a trend here. And she holds a Master of Public Health and a PhD in Health Services Research, also from UNC Chapel Hill. So thank you to Colleen and both of you really for being here today. We really appreciate it. All right, so let's start with just how you would each characterize the state of outbreaks in your jurisdictions. What types of challenges are you facing each day? Who wants to start? Old friends, who wants to start?
Okay, I'll jump in. Just jump in. Currently, our situation is fairly stable in Mecklenburg County. Over the past couple of months, we've seen our numbers slowly drop, and we're continuing to see mild decreases in the metrics that we follow. But we consider ourselves to be fairly stable at the moment. We are watching very closely because we've got a number of things that are starting to open up in the county. Some of the challenges that we see, we continue to see outbreaks in our congregate living sites. And we can continue to see outbreaks among small and large gatherings in our community. Obviously, like everywhere else, there's economic issues in our community, and that has impacted people's interest in being tested and willingness to isolate and quarantine when they need to. And we understand that that's an issue. We're working with our business communities around making sure that people have the resources they need. And as our numbers drop, we're seeing more and more folks sending plans to us to review. They want guidance, they want approval to open up. More and more and more of that. And I've spent a lot of time with the Panthers, our football team lately. And we're also seeing a little bit of a challenge staying focused on prevention measures. As things improve, people are like, we're done. So we're continuing to have to make sure that people understand that we're not out of the woods and that they need to stay focused on that. And the last thing I'll mention is that this, typically a crisis, hurricane, flooding, whatever, lasts a week, maybe two. This particular crisis has lasted long enough for it to become very politicized. And that's an issue that we deal with day in and day out. So I'll stop there.
So I would say in San Antonio and Bexar County, and kudos to you, Chrissy, for pronouncing it correctly. That's awesome. For those of you who don't know, it has an X in it. So sometimes people don't know whether to pronounce the X or not.
I got schooled early on.
Okay, all right. So I think similar to what's happening in Mecklenburg County, we're seeing, I think we've had the last 3 weeks, we've noted a consistent 14-day decline with no rebounds. So that's been good. We have had, what we're starting to see is a little bit of the post-Labor Day blip. So hospital numbers are increasing just by, 6, 7, 8 patients a day. So not a lot, but they had been consistently declining until 2 weeks post-Labor Day. We're also seeing the number of cases just kind of tick up a little bit, which again, we're attributing to kind of that post-Labor Day effect. We also have had some private schools open for face-to-face instruction. We're starting to have public schools open. The governor just allowed unlimited school occupancy. So we're watching that with some trepidation to see what that might do. So that's a little bit worrisome. But just like Gibbie said, our indicators continue to trend in the right direction. I think our positivity rate was around 6% last week. So that's making great progress from, it was above 25% in July. So we're making good progress there. Speaking to Gibbie's point about the fact that this has been going on for a long time, not only does that allow more opportunity for politicians to weigh in on what's right and what's wrong, but it also, at least here in San Antonio, allows non-public health experts to weigh in on what's right and what's wrong. And we're getting it from both sides, right? We've got the people who think we're doing too much, and then we've got the people who think we're not doing enough. We've got some people who think we should literally be locking everybody up if they have a COVID diagnosis. The other challenge we're dealing with is this fixation on asymptomatic transmission. That has become a real challenge here, because when we're doing case investigation and contact tracing, we're finding the vast majority of people know who they came in contact with, who had COVID, and yet there's this real conspiracy theory floating through the universe here in San Antonio about how all of our cases are from the silent carriers and all of those items that how do you deal with that from a public health perspective?
Okay, so each of your jurisdictions saw community spread a little later than some other areas. So what were you able to learn by watching your colleagues around the country that helped you prepare for what you would see sort of later in the spring or in the early spring?
Colleen, you want to start first this time?
Yeah, I will. So we did. The other thing to note, though, that also helped us prepare was we were one of 3 cities that received federal evacuees from Wuhan, China at first, and then from the cruise ships. And so we got a lot of kind of hands-on experience with communicating about the risks of COVID-19 and how it's transmitted and how it's not transmitted and what we knew at the time. So, while it was happening, it felt a little bit overwhelming. But in retrospect, that was a really good kind of training wheel opportunity for us. We did watch other cities, though, as they, both on the East and the West Coast, were being they were having higher rates of infection than we were seeing. And a couple of takeaways that we had from the West Coast, for example, is we quickly cohorted our nursing home facilities so that we transferred all of the COVID positive patients into cohort facilities. And what we've seen as a result of that is that our death rate at nursing facilities and assisted living facilities is about half of the national rate and half of the state rate. So I think that was a really great lesson learned that we were able to implement pretty quickly. On the hospital side, again, looking at the East Coast, we were able to put some measures in place to again, more quickly discharge people from the hospital into some of these nursing facilities that were specific to COVID, to allow them to step down and not use bed space that would be needed for the more acute cases. So I would say cohort facilities, and then just the ability to not have to have everybody, regardless of how sick they are, in the hospital, were 2 lessons we got from the East Coast and the West Coast.
Great. Gibbie?
Yeah, so we didn't have the same experience. We didn't get the sort of the bolus of folks from outside into our community. Unfortunately, we didn't have the first cases in North Carolina, but we quickly became the hot spot in North Carolina, and unfortunately have been there ever since. Part of that is our size, but there's any number of other things that led to that. What we were able to do, we were watching what was happening in other places. Number one, learning from the different communication styles and what was working and what wasn't. And learning from that and incorporating that into messaging that we were putting out in our community was very helpful, I think. But also, excuse me, we were watching what was happening with travelers. We have a very busy airport, and so we made some changes very quickly that I think helped us manage what was coming through the airports a little more quickly than we might have otherwise. And the other thing we learned was that we needed to act quickly and that we didn't need to wait around until we had a lot of cases. We very quickly put an emergency proclamation in place. And prior to the state moving to a stay-at-home order, we did that here in Mecklenburg County. And those things, I think, helped us move a little more quickly than we might have if we weren't able to see what was happening in other places. And the last thing is, you know, again, watching what was happening here, but also in other places, recognizing very quickly that we were having issues in certain populations and starting to do the things that we needed to do to address that. Whether, I mean, nursing homes obviously have been an issue for us from the beginning and continue to be here. But our African-American community spiked very quickly. And shortly after that, our Latino community spiked as well. So seeing that that was coming in some ways, but also making sure that we were paying very close attention to the data, maybe more so than we would have otherwise based on what we were seeing in other places.
So both of you have been in a little bit of the middle of national drama. So, you know, Colleen, you mentioned that you had the cruise ship evacuees. Gibbie, you just had some Republican National Committee events. So let's start with you, Gibbie. What was that like? How did you balance the politics of it all with still, you know, being the local health director and having to protect your community as well as, you know, people who were coming into town for the events?
Well, the first thing I'll say is ARG. It was like, don't need this. I mean, we spent at least a year prior to all of this planning for the RNC. We obviously expected a whole lot more people. And one of the biggest challenges we had was this moving target. We weren't sure whether folks were coming here, whether some of them were coming here and then going to Florida, then they were back coming here, how many were coming. So those challenges, just in terms of planning, really complicated things significantly. We had a very robust, quick planning process here that engaged and involved our medical facilities, as well as emergency management, and to a great extent was driven by a contractor through the RNC committee. So we put some pretty strict guidelines in place fairly quickly, and got the support of the RNC committee, the one on the ground here, but also agreement from the national committee to stick to those. So everybody got tested before they came. Everybody got tested when they came here. And so we were doing our best to make sure that we were creating a cohort that was a little bit in a bubble. We also tested all of the staff that were going to interact with them the week before. The challenges, some of the challenges we had, I think, one was interpreting testing results. We had several people that tested positive who had been infectious and tested 2.5 months before they came. And we recognized very, very quickly that they were probably not infectious, and we had to make decisions about whether we let them come or not. Once we got here, we had 2 people from the attendees who tested positive. One of them had been positive 5 months ago. And we tested her one day, we tested her the next day. She tested positive both days. We would not let her attend. So there was finessing around the testing. It wasn't as simple as you are either positive or negative, and you can come and not come, or participate and not participate. And actually, and everybody had signed off on doing the things that we asked them to do. Social distancing, not congregating in groups, wearing masks. There was some very specific requirements of them. They did a great job until the last day when we had the the roll call. And it just sort of went downhill very quickly. People were running at the stage. When the president came in, they were not wearing their masks. They were grouping together. They were hugging, shaking hands. And I called my contact with the RNC and I said, y'all have got to stop this. And they did what they could, but there was a limit as to what they were able to do. And I called them out in the media. I mean, it was unconscionable that these folks were visitors in our community, had agreed to abide by certain things to keep our community safe, and then just blew it all out the window. So it was good up to that point, but it went south very quickly. And we know from what we're seeing is that some of these gatherings that are happening, political gatherings, whether they're from the federal level on down to state gatherings, that people are just not complying. And it is what it is at this point.
So Colleen, you mentioned that you had early on some cruise ship evacuees. And I know there were some challenges there. There was a lot we didn't know at that case and at that point, and a lot of sort of shifting guidance. So, you know, similarly, how did you balance protecting your community, but then also dealing with all these folks that you were hosting too, and protecting their health?
Yeah, it was whew, at the time it seemed like a really big deal. Now it's like nothing, but so it was a federal decision to bring evacuees to one of our military bases here in San Antonio. The way it was portrayed, we were not involved in that decision. The way we were informed was, this won't affect you. They're coming onto the base, we'll take care of them. There's no problem. You don't really need to know any of the details. This is all just fine. This is a federal response. We just happen to be in your city. Then one of the evacuees developed symptoms. And that was when we learned that the Department of Defense had issued an edict that said nobody with symptoms will be allowed to stay on the base. And so then suddenly it became San Antonio's problem. And so the woman had to be hospitalized, and then there were multiple others who developed symptoms who had to be removed from the base, placed in the hospital while we waited on the test results. And again, that was back in the day when the only place that testing could occur was the CDC. And so there were a lot of people transferred off the military base for things like allergies or GI symptoms, or anybody who wasn't feeling well was presumed to be infected and therefore removed from the base and placed into our community. Messaging that was incredibly difficult because we didn't know very much about it. We didn't really understand exactly how it was spread. We didn't entirely understand what the symptoms were. We had no control over the testing. And I mean, even as Gibbie alluded to, we didn't, especially back then, understand what a positive test meant. And so we had this protocol of, before somebody could be released from the hospital and released from quarantine if they had been infected, they had to have 2 negative tests. And so we had a woman who had been hospitalized for over a month who recovered and was ready to go home and was in that, okay, you have to have 2 negative tests protocol. She had a negative test. Then there was a delay in getting one day's test to the CDC. The following day's test was negative, but the one in between actually came back the next day. So she had 2 negative tests, but the one that came back from the day that they missed was positive. But they had already released her from the hospital. She had gone to the mall. She had rented a car. She had gone to the hotel. And that was just absolute chaos and confusion, and everybody was super, super worried. We had people, I mean, anybody who had ever been to the mall in the last year was sure that they were exposed now for COVID. And so really trying to reassure people that that wasn't what was going on. And then, the other challenge was working with the federal government. So working with the CDC, working with HHS and the DOD, those guys didn't talk to each other. And the federal level didn't do a very good job of communicating with us. We had different incident commanders at different points during the event. Some were incredible and were really great at communicating with us. Others were just MIA. And so that was a real challenge for us as well.
I think I have a few text messages from you during that time that we won't talk about online.
Yeah.
So you both started to get into this a little bit. Your jurisdictions, like so many big cities and counties across the country, are pretty diverse. And, as a country, we've been seeing huge racial disparities on impact of cases and deaths. So how have you approached this challenge in your jurisdictions, thinking about data and testing and resources and sort of all the related systemic issues? Gibbie, you want to go first?
Sure. And one thing I'll say about the last piece, when I said that I called these folks out, I was very clear that it was not political, it was public health. So I just want to put that plug in. So we, like I said, we very quickly started recognizing issues in our African-American community through the data that we were collecting. So in terms of testing and deaths and looking at locations in our community where people were testing positive, it was obvious that this particular group in our community was disproportionately affected. And that started fairly quickly, and we pretty quickly put in a process for communicating. We developed a campaign that was specific to the African American community. We engaged the African American churches to help us with that. And I will say, in addition to that, our community raised a lot of money right up front. Many of our big corporate partners put a good bit of money into this. It was all went to a local foundation that created a process for pushing this money out, making sure that people that needed resources were able to get them, whether that was through nonprofits in the community or other processes. And we also looked at working with our testing partners to make sure that we created some mobile testing so that there were testings available in the communities where we were seeing these bigger issues. And then late spring, all of a sudden, our Latino community went from about 14% of our cases to 50% of total cases in like a couple of weeks. It was just this huge jump. And so again, backing up and trying to understand what was going on here, we also recognized that our Latino positives, the folks in the Latinx community that were positive, were much more likely to be in the 20 to 39 age range. So it was a much younger population, and we started looking at where they were being exposed. We had a lot of issues in our construction industry. And we also were seeing a lot of these folks, both African Americans and Latinos, are essential workers. So they were back at work when others were not. But we also recognized in our Latino community that a lot of these folks live in multi-generational households, and the whole household was becoming positive, which were bumping the numbers up as well. And to put this in context, our Latino population in Mecklenburg County makes up about 12 to 14% of our population. So when they started bumping up against 50% of our cases, that was really concerning. Couple of things quickly that we engaged in were some public-private partnerships to get some messaging created. We created a whole campaign focused on both Latino and African American, but in general around masking, and making it specific to the cultural norms of those communities. We also had a public-private partnership called the Million Mask Initiative. And right at this point, we've almost put out 2 million masks into the community. So, and then of course, the mobile testing that I talked about, and making sure that we were making testing available in the spots where we needed to. I mean, one of the challenges that you have when you're doing this is if you test in a specific community, you're going to find positives when you've got community spread, which we've had since almost the beginning. So we had to balance where we were testing with the numbers that were coming from that to make sure that we weren't over exaggerating the extent in that community. But we've now seen a drop in our Latina community to around 25%, so that's improved some. And we're just continuing with the messaging, making sure resources are available to these populations, because these are the folks that are going to get hurt if they don't go to work. They may lose their housing, they may not be able to feed their family, whatever the case may be. So we're making sure that there's dollars available to support them during a period of time when they may need to be isolated or quarantined.
Colleen?
So I'm trying, I mean, we weren't that different from Mecklenburg, so trying not to repeat what Gibbie said. I think building on what Gibbie said, you know, we did have isolation care facilities that we made available for individuals if they needed to separate. The other thing that we did that I was really proud of San Antonio for doing is in the middle of all of this, we used all basically of our federal dollars to launch a recovery and resiliency plan. And what that did was provide emergency housing assistance for tens of thousands of individuals. It also launched a workforce development initiative that provided a $400 a week stipend to individuals while they were going back to school and learning a new trade so that they could go back to work. We also expanded on the federal small business grant program and launched our own small business grant in order to help the employers stay afloat during the pandemic. And then we worked with our, we have like 17 school districts in San Antonio, but we worked with them to create a digital inclusion program where we invested $25 million into expanding access to the internet for parents and students in order for their kids to be able to access education via the internet. So in addition to responding to COVID-19 and dealing with, you know, all the things that Gibbie talked about, we also took the longer view and thought, you know, if we're going to be able to get through this and be stronger and more resilient the next time something like this happens, we need to take this, and so far it's about $200 million, and invest it into the community's resiliency. And so I was really proud of San Antonio for doing that.
That's a great story. We'll be coming back to you for that. That's so
I will say we did some of the same things, but not to that extent. You know, we've got some of the same programs in place. And, you know, it's amazing to me to see how cities have stepped up and been willing to address this, because it really is not just an epidemic of COVID, but there's the whole issue of the economics of it, and being able to make sure that you're addressing both of those is a huge balance.
Yeah, and I think really showing how you all have used federal dollars to invest in your communities is an important message, you know, to share back with policymakers who make decisions about how many dollars are going, you know, to whom and when and so on and so forth. Okay, so let's shift gears a little bit to talk about schools. So I had a question for you. There's also a question in the chat. So, you know, you mentioned how many school districts, Colleen? 17?
17.
So, you know,
Yay.
there's
Public school district. We also have private schools. That's just public.
So there's the K-12 question. And then there was also a question in the chat about UNC Chapel Hill, which I think we all followed, you know, in the media sort of across the country. So Colleen, let's start with you this time. Let's talk a little bit about what you're doing in your K-12 schools, and then, you know, also how you've been considering colleges and universities and what that has looked like.
We have, of course, we had some drama around schools. So in the beginning, it was not clear who made the call about whether schools should open or not. Then it was communicated that it should be the local health authority that would make the call. So we scurried around trying to figure out what indicators we wanted to use in order to quantifiably analyze the situation and make that data-driven decision. Then I think it was the Attorney General said, no, local health authorities, you can't make that call. And so then the governor said, well, the state agency that oversees all schools needs to make the call about when they can open. So we pivoted to providing guidance and recommendations to our local schools. So we created an indicator bar that said, here's where we are as far as safety for opening schools. And if we're in the red zone, then here's what it means, if we're in the yellow zone or if we're in the green zone. And so we publish that every week. We are currently in the yellow zone according to our data, which means very limited in-person school in very small class sizes, primarily for special needs kids and other kids who don't have access to the internet. But yet there's still, the state's guidance is, as of early this week, come one, come all. Our local districts are doing a good job of being fairly slow and safe in reopening. But I think it's going to open more quickly than the public health officials here in the county are comfortable with. On the college and university side, we are working very closely with them. We have an entire group of our pandemic response that is dedicated to both K through 12 and community college and universities on helping them figure out how to reopen in a safer manner. You know, we had a football game this weekend, and but there were only 3,000 people in attendance, so that helped a little bit. So a lot of, like Gibbie said in the beginning, a lot of reviewing of plans, providing recommendations, you know, communicating transparently about the data. When we have two connected cases in a school, we're just flat out calling that an outbreak, and you know, working with contact tracing, case investigation in those, we're calling them congregate settings, in order to try to nip that in the bud.
Gibbie?
So, yeah, so the state here has actually provided options and have left some of the planning up to the school districts. We just have one school district in Mecklenburg County. It is quite large, which it creates all kinds of challenges. And we provide the school nurses for the school districts. We have a position for every school, but obviously we don't keep all of those filled all of the time. That's an ongoing issue for us too. We've spent a lot of time with our school system working on their plans, giving them guidance and advice on different things that they could do to make sure that the schools are as safe as they can be. We've worked with them on training for their teachers to help make the teachers as comfortable as they can be coming back. And we did work with them to develop a set of metrics that included some public health measures, but also some specific school measures around operations and staffing. Just recently, the schools have decided to slowly start moving back into the schools. The state plan was allowing up to 50% occupancy at a time. We've got too many kids in each school to do that, so they're doing a third, which is challenging for parents. That has added a whole nother layer of complexity on this, is how do you keep people at work when their kids are in school every third week? Exceptional children are going back next week, and then we're looking at pre-K a couple of weeks after that, and then after that, K through 12, and so forth. So all of them won't be back into school until close to the end of October, but all on a staggered basis at this point. The governor just changed his recommendations around that. Well, not recommendations, but guidance that people K through 5 could go back full-time if the districts wanted to. I don't think ours will do that at this point. So that's ongoing. Obviously, our school nurses are working with them around testing issues and around identifying cases and contact tracing and those sorts of things. We've had a mixed bag with our colleges. Several of them decided to go virtual through the end of the first semester. What I've found very interesting is even though their students are virtual, they're still playing sports. And we've seen some outbreaks in some sport teams. It's just really kind of an interesting, where's your priority here? Our main college here, UNC Charlotte, which is not Chapel Hill, based on conversations that we had and recommendations, I suggested that they wait until the 1st of October to think about opening. So they've been virtual up to that point. And they announced yesterday, more conversation that we had around this, they will go, they will bring back some students, mainly those that are new to college and need some support to get acclimated, and those students who need to have access to labs and studios and those sorts of things. So they're not opening full. And then after Thanksgiving, they will not bring students back until after the first of the year. And I was just tickled pink when they told me they were going to require all of their students, all of their faculty, and all of their staff to have a flu shot. Mm-hmm. So I feel like we've made some progress here. It's an ongoing issue. We have staff who are assigned to all of these facilities to work with them on their testing plans and on making sure that they're doing, and we're doing with them, the contact tracing that needs to be done. So we're trying to keep things down. We have not had the issues that UNC Chapel Hill had. We have avoided so far, knock on wood, some of those big parties. So we're hoping to continue to move in that trend.
Ironically, my daughter is doing her online PE class on the other side of my wall. So there's been like, it did not cross-reference her schedule and mine. So let's talk a little bit about flu vaccines, because you brought that up. So there's a push to make sure that more and more people get vaccinated this year for the flu. So let's talk a little bit about that, and then how does that affect your planning for an eventual COVID vaccine? I forget who started. I guess Colleen started. I don't know. Someone who wants to talk.
We are beginning to do planning. Obviously, we're one of the states where the vaccine will come down through the state, and the state's developing the plan. We've had too many cases this year where we've asked for guidance and it's not come soon enough for us to be able to react on the ground. So we've gone ahead and put guidance in place. And then the states come out with guidance and it's never exactly the same. And we've had to finesse that. That's happened multiple times. And so when we can wait on the state to get theirs out, we will do that. But we're already having conversations. We're engaging some medical experts in the community around the issue of vaccine safety and those sorts of things, and are hopefully we'll be utilizing those as champions for the COVID vaccine. And as we plan for flu vaccine, both in making sure that vaccine is readily available, making sure that we're doing what we need to with the vaccine that we have, making sure that our partners in the community are all linked up and that we're working together to get vaccine out as efficiently and effectively as we can, and focusing on some of those priority populations who may not have good access to vaccine. But then the other is the communication piece. So we're putting our plan together with all of those pieces and see that as sort of a framework for the COVID plan as we move forward on that as well. And then as we get more guidance from the state, we'll build that in. So that's sort of where we are in the planning process.
So San Antonio is one of the cities that's getting extra attention from the feds when it comes to COVID-19 vaccination. As a result, one of the things we're doing is practicing the strike team concept that we expect to roll out with COVID vaccine with our flu vaccination clinics. So we're kind of practicing the logistics of what that would look like, but giving people flu shots instead of COVID shots. So that's one of the things that we're doing, in addition to a lot of the other things that I'm trying not to replicate or duplicate what Gibbie said, and try to think of other new things to say. One of the other things we're doing is working with so we have a COVID-19 community response coalition, has a couple hundred people on it that are in different work groups that focus on different components of the pandemic response. One of those groups is education. And so we are working with them to roll out a campaign specific to vaccine hesitancy, because we're seeing a lot of the studies coming out saying that even if there is a vaccine available for COVID, that people aren't going to take it. So we're trying to get in front of that now by just doing a kind of generic vaccine hesitancy education campaign, encouraging flu shots, but then hoping that that will also work towards encouraging vaccination against COVID as well.
So we've talked a lot about, crisis communication and communicating with the public. Talk to us a little bit about what it's been like dealing with the media over the past, 6-7 months. Has it been different than in the past? Better? Well, I won't ask you to say better or worse. We'll go with, has it been different in the past, and what does that look like in your communities? Colleen, why don't you start?
So I'm pretty sure Gibbie has laughed at me in the past about my Pollyanna attitude with the media. I was always the person who was super engaged with the media, open, transparent, shared everything. I just really never had a bad experience with the media until COVID. And so it was a real shock to me, because here I am, little Pollyanna, the media is always so great to work with, and we're going to do this and we're going to do that, media is not going to be a problem. And then they whacked us upside the face multiple times. And so after, a couple of weeks of that, we rebooted, and the biggest challenge in the beginning was this whole conspiracy theory of you are intentionally withholding data. And I kept saying, guys, you need to give us a little bit of time to get this daily data machine going, because public health doesn't do daily data. We make sure everything is sparkling clean before it gets released, and that takes years. So we need to completely retool our thought process and our data process to be able to get you this information. But no, the conspiracy was we were withholding the data because we didn't want the community to know how bad it was. So we had a conversation with the media and sent out a survey and said, we cannot give you, some of them were asking for, names, addresses, and telephone numbers of every single person who had COVID. And we were like, okay, HIPAA, this is not a new concept. But we put out a survey and said, tell us what the most important data points are to you. And we will prioritize a report that has that information that we will release on a daily basis so that you don't have to keep calling us. We have news outlets with like 5 people who work for them, and all 5 of those people were calling different people in the city asking for the same thing. So we did the survey, we came up with the list of priorities. We then put out a daily report that had the media's prioritized information. So we resolved that issue. Then we started having some, the conspiracy theories have been constant, and trying to answer the questions in a way that the general public can understand. When you're talking about case definition, is really hard. And so people assume that if they don't understand, that we must be doing it wrong or that we must be hiding something. And it's so frustrating. And I find myself, for the first time in my 25-year career, losing my temper with the media. And being called antagonistic with the media, which is not me. I am Pollyanna. Media, I love media. They love me. I don't know what's going on. So it's been horrible. It's been unlike anything I have ever dealt with. It's really complicated information. They're getting mixed messages from the federal and the state level. They don't know who to trust. I get that. But they don't trust us. And when they don't trust us, that relationship is just absolutely almost unbearable at times.
Gibbie?
Yeah, so I've had varying experiences with the media in my career, depending on where I've been. But when I came to Mecklenburg, there were issues with the health department anyway, so the media was already all over that. And I experienced what the media here in Mecklenburg County is like right off the bat. They're very aggressive. They're incredibly engaged, and there's never enough information. So I was already dealing with that before COVID came along. And actually things had calmed down a little bit, but COVID in the beginning actually for me was better because I was being transparent. I was giving them information and they really seemed to be pleased. But as time has gone on, they question things more. What they're hearing from us doesn't always gel with what they're hearing from the state or what they're hearing from the federal government. And so that makes them question things and ask things in different ways and pepper you with the same questions over and over and over again. Just try to ask them a little bit different to see if you'll give a different answer. And part of the issues go back to what Colleen was talking about with the data. The state captures data one way. I'll give an example. So the state reports the number of positive tests coming out of Mecklenburg County. They do not look to see if those are Mecklenburg County residents. They are people coming into our community that get tested. We don't report those folks who are tested that come into our county that belong to other counties. So it took a month to get that particular issue cleared up. We want to report what's happening in Mecklenburg County proper and the citizens that we have here. That's just one example, but and anytime anything pops up, we try to be transparent. We try to give them the information, but if it's a little out of kilter or if there's a little bit of question mark about it, then it's like the sharks come out, and you just have to deal with it. So unlike Colleen, I had already dealt with that sort of press media approach here in Mecklenburg before COVID came along. So it's not surprised me. And I think if, you know, if I had to give anybody any advice, if you're going to do this kind of work, you've got to have a thick skin and you can't take it personally. I mean, those are just, and those are challenges, I think, when you're dealing with the sort of stuff that Colleen was talking about with the media, not trusting what you're saying and what, you know, the information that you're giving them. Because we know we're trustworthy people.
Yes, we are.
Yes. So they need to understand that we're giving them what we have and that we're being as transparent as we possibly can be. So,
I mean, it's so interesting because, you know, when I talk to national media, sort of the first thing I lead with is like, being a local health official is not a glamorous job, right? I mean, you two are glamorous, but the job is not glamorous, right? So, you know, I try and sort of frame it as all of the challenges that y'all deal with in normal times and then COVID times. I will say that, just so that we can have some equal time here, the national media that I have dealt with in this pandemic have been amazing and like have really been almost to the point of impressive, you know, compared to I think previous conversations. And so, you know, finding this balance, I think moving forward, we're all going to have to continue to do that. And I think part of that is all of the questioning and the politicization and all of this that we've seen in this response. So it's something I think that we're collectively going to have to rebuild. On the list of things to rebuild, that's one of them. I do have a question that I want to get to about sort of politics and data, and then we'll go to our closing questions. So there's a question about the positivity rate in San Antonio. Colleen, you mentioned it was 20% in July, and now it's only about 6%, and sort of how valid that number is, and is that a political number, or, you know, is that a true data outcome that you guys have seen locally?
So that number is not at all political. That is locally calculated via a survey that we send out to every lab that does COVID. They send us their daily positivity rate, and we calculate that on a weekly basis to say, here's what our weekly positivity rate is. It's a sample, so there's a little variability there, but it is combined with the other metrics that we look at, which is the case number, the hospitalization number, the decline in the positivity rate from July through now has been mirrored by a decline in cases. We had several days in July where we had new case numbers of over 1,000 every day. We also had over 1,200 people in the hospital at one point due to COVID. And we're seeing that number come down. That number is now right about 200. Our 7-day rolling average cases is about 150. So if it were just the positivity rate all by itself, I wouldn't trust it. But it, along with the other trends and data points that we look at, are all declining precipitously. I trust it.
Great, thank you. Okay, so closing question that we've done with on many of these webinars. Looking ahead, what gives you hope? And you can't just say vaccine. It needs to be bigger than vaccine. But if that's really your answer, that's fine. Gibbie.
What gives me hope? What gives me hope is the fact that our community, I'd have to say, for the most part, is doing what we're asking them to do. They are stepping up, and I know you know, our younger population struggles with it more. But the fact that our numbers have come down as well as they have, we never got as high as San Antonio, but we're down right around 5.2% positivity rate. And so people are wearing masks, they're doing social distancing, they're trying to behave themselves and do what we're asking them to do. And, you know, I mean, we've made the point over and over. The whole idea is to get our community open again for everyone, and everybody's got to be part of that solution. So That's what gives me hope.
What gives me hope that's different from Gibbie's is I think at least here in San Antonio, Bexar County, never has the word public health been said so many times. And so, you know, for example, our city allocation to our budget, non-COVID related, just like violence prevention stuff, was increased by a third this budget year in the middle of a pretty significant recession where everybody's budgets are being cut. And so I think the realization of how important public health is to the resiliency of the community has been really exposed, and a light has been shown upon it. And I think we're in a great position to be able to capitalize on that as we move forward.
Great point.
That is the piece of all this that gives me hope as well. I often answer that. So thank you two for telling the public health story and for the work that you do in your communities. This is the 8th BCHC webinar, and our next 2 sessions are scheduled for Wednesday, October 14th with Boston, Massachusetts, and Baltimore, Maryland, and then Wednesday, November 4th with Houston, Texas, and San Diego, California. Folks can register for that on our website, excuse me, and then also see the previous sessions, as well as sign up for our newsletter, which also will let you know when we schedule additional sessions. So thank you both so much. This has been fun. I mean, as fun as talking about a worldwide pandemic can be. So thank you for your time, and thanks everybody for tuning in.
Thank you.
Thank you. It's good to see you, Gibbie.
It's good to see you, Colleen, even across the country.
Yeah.
All right, bye guys.
Bye-bye.
Bye.